Hello. Today we'll be discussing the final of the 5 microskills, correct mistakes. This skill aims to appropriately identify and correct student errors and inappropriate judgments. However, it's important not just to point out mistakes, but to provide constructive feedback and use them as learning opportunities. For example, you might give feedback like this. In your differential diagnosis of chest pain, I noticed you didn't consider acute coronary syndrome. When evaluating patients with chest pain, it's crucial to first rule out life-threatening conditions. Let's keep this in mind moving forward. When you performed the neurological examination, you focused primarily on the affected side and didn't compare with the unaffected side. A comparative examination is essential for accurate neurological assessment. Next time, let's remember to examine both sides systematically. While you were very thorough with the patient's chief complaint, the systematic review of systems was incomplete. A comprehensive review can reveal unexpected findings that might be relevant to the patient's condition. Moving forward, try to maintain a systematic approach regardless of the presenting complaint. This approach has several important advantages. Correction of incorrect knowledge and skills. By correcting mistakes, we can prevent inappropriate clinical judgments and actions. Promotion of critical thinking. Considering why a judgment was incorrect helps develop critical thinking skills. Enhancement of safety. Contributing to patient safety by preventing medical errors. Improvement in self-assessment. Developing the ability to recognize and correct one's own mistakes. Promotion of continuous learning. Using mistakes as learning opportunities promotes continuous growth. There are some important points to consider when using this skill effectively. Feedback should be specific and constructive. Don't just point out mistakes, suggest directions for improvement. When possible, provide feedback in a private setting that respects privacy. Encourage students to view mistakes as learning opportunities rather than personal criticism. Be mindful of students' feelings and include words of encouragement. When possible, create opportunities for students to recognize their own mistakes and think about ways to correct them. Correct mistakes is a crucial process for student growth. However, if done inappropriately, it can damage student confidence and decrease learning motivation. Therefore, it's crucial to use this skill in a constructive and supportive way. This process can also be a growth opportunity for instructors. Through students' mistakes, instructors can reconfirm and update their own knowledge and skills. Finally, I want to emphasize the importance of fostering a culture of learning from mistakes rather than fearing them. Medicine is a field that always involves uncertainty and complexity. The ability to properly handle mistakes and learn from them is an essential skill for excellent healthcare providers. This concludes our explanation of the 5 microskills. Next time, we'll discuss how to integrate and utilize these skills in actual clinical education. Stay tuned.